I first started noticing a problem that I was really tired all the time. So I went to the doctor thinking, oh, I just need some more vitamins. But when I went to the doctor, I was quite alarmed that he said I had under 5% kidney function. So I started dialysis. So being on dialysis 3 times a week had a significant impact on my life. I didn't feel well enough on the days that I dialyzed to come home and take care of my daughter. I could no longer work. I could no longer go to school. I didn't feel well enough to do anything. So it was really life-changing for me when I first started.
The Incremental Dialysis Program began in 2020, and it was really in the context of some work that I had participated in previously with a couple of my colleagues at the University of Calgary. In that project, we were working with patients to identify patient priorities for those who were being treated with dialysis. They all kind of said, we get dialysis 4 hours, 3 times a week. We have no say in the schedule. We have no say in the duration of treatment. So individualizing treatment was important for them. And the intention was to co-design a personalized dialysis program for patients starting renal replacement therapy.
Prior to our program, at least in Alberta, within facility-based hemo, all patients that started on long-term hemodialysis were given a prescription of 3 times a week. That was regardless of patient need or where they were at on their journey, their residual kidney function, just everyone got the same prescription. And that's more based on historical tendencies than actual clinical need. How we do things differently with incremental dialysis is assess those patients coming onto facility-based hemodialysis to see if they could safely start at twice a week. And about half of the patients that were assessed were able to go on to incremental dialysis.
Newer studies had looked into patients who started dialysis twice a week versus 3 times a week in the beginning of their dialysis journey, and it had shown that this was safe to do from a patient perspective, and also that it may have had some benefits.
Partnerships were so important to incremental dialysis, to have leadership buy-in and support, because really it was their teams that were going to be doing the education, the assessments, the actual implementation of the program. It really opened a lot of doors for us and made things much smoother than I think it otherwise would have been.
My name is Steve, and I'm 55 years old. I've had polycystic kidney disease since I've been 35 years old. I started dialysis when I was 52, and I had a transplant at 53. For me, having that extra day meant another day that I could spend at work and more time I could spend with my family.
We've heard that incremental dialysis can change patients' experiences. It also helps preserve some patients' their residual kidney function, so actually just how well their own kidneys are doing what they should versus the dialysis machine, that it can help them keep their own kidney function longer, which is a bonus, of course.
I'm a big fan of personalizing dialysis and personalizing treatment in medicine in general. So I love the fact that it puts the patient at the center.
I feel that the patient involvement was extremely important because it gives me, I think, and others the confidence that what we're doing makes sense to patients, will impact them positively, that we're not missing possible negative impacts or inappropriate approaches, that we are more likely to be successful for a wider variety of patients.
There's real patient impacts, and I'm here to show that. There's a real impact to my life to be able to start on incremental. Why give the patient more dialysis than they need? Because the system works better that way.
Every number in a table or a chart represents somebody who had an extra day to their week that they could positively use as they chose while still getting safe and appropriate care. I'm just thinking those are real, live individuals that we're helping to improve the lives of, and that's what I'm most proud of.
Dialysis is really hard and the recovery time is really long. And so if you had more time in between runs to recover, that really helps you physically. It's also good for your mental health. It is so hard to be at dialysis mentally, seeing other patients be very sick. It reduces costs by 30%. By having patients dialyze less, it actually opens up more space for more people to dialyze in units. Also, that cost savings could be put towards other programs to help patients with kidney disease in the future.
I would hope that after implementation in Alberta, the other provinces could also follow suit and make sure that this is a Canada-wide system, because I think this project has done a very good job at showing that this is a very feasible way to provide dialysis to patients.